for everyone to sign in. Welcome to SCORE Bucks County's webinar on health insurance for small business. My name is Linda Zangrilli. I'm the current chapter chair for SCORE Bucks County. So just for a few minutes, I'd like to talk about, first of all, housekeeping. This session is being recorded. You will be able to get a copy of the recording. Please hold your questions until the end. And if you have questions along the way, put them in the Q&A, not the chat. And we will address all questions at the end of the program. Also, please refrain from advertising your business in the chat. We would appreciate that. Okay, SCORE Bucks County is a national, part of a national nonprofit organization. We have some 350 chapters and 13,000 members all over the United States. We have one very simple mission, and that is to help small business start, grow, and prosper. Here in Bucks County, we cover all of the county as well as Eastern Montgomery County, and we have some 70 members who come to us from all walks of life. Some have come out of corporate America, some have had their own business, but we have experience in all disciplines. So I mentioned that our mission is to help the small business owner grow, and we do that through webinars like this. We have these just about every week, and thanks to COVID, we're free and virtual. And we do this through free mentoring. We've always done free mentoring. So if you're a small business that needs a little bit of help, maybe you need to know how to get started, or you have started and you just need a little push, please go to our website, and this is also in the chat, buckscounty.score.org. And all you have to do is hit the big button that says, I want a mentor. And we take it from there. You fill out the information. Our operations team takes over from there and assigns you to a mentor. Mentoring sessions can be as few or as many as you need. We don't abandon you, and we never charge you. So it's really a win-win for you, our clients. In addition to that, we are a resource partner of the Small Business Administration. So we have lots of resources behind us, both from our national organization, score.org, as well as the Small Business Administration. We have many, many resources to tap into. So if you get a mentor and the mentor needs help from any of these other areas, we tap into them, and the end result is we help you. So that's my little pitch for today. It's one that's important because we don't put SCORE up here. We have our seminar leader today. He has his slide up, but we want to make sure you know who's putting this presentation on. So without further ado, I'd like to turn over to our seminar chair. His name is Ed Torello, and he's the gentleman who finds all these wonderful speakers for us, gets these programs going. And as I said, we do these about every week. So Ed, why don't you take it from here?
Thank you very much, Linda, and thank you all for joining us. I think you're going to find this very, very interesting. We have today Ron Hyman, who's the owner of the insurance shops. And Ron is a licensed agent, and his organization is for all types of insurance. And it's very interesting to know that they represent over 200 different companies, and they're a leading expert health insurance broker for Montgomery County, Bucks County, and the Philadelphia area. They also serve clients all up and down the East Coast, and they are one of the highest volume agencies out of over 150 agencies in the Philadelphia general area. So I'm going to turn it over to Ron so that he can start the presentation. Ron?
Hi, everybody. Thank you for that introduction and welcome. I'm sure health insurance is very topical in the news the last couple of years, and there is a lot of changes going on, and it is really nothing the way it used to be. When I got in this business years ago, everybody was rated up, or you had to fill out medical information if you wanted health insurance. Denials were rampant. It was close to 80% of the people that were applying in the past used to get denied or rated up in some way so that it was unaffordable. It's not like that anymore, and it's actually a good thing. So why don't we move on? In this webinar, we're going to explore health insurance options available to the small business and their employees, exploring such things as groups and individual plans. Have to move on. Okay. Topics that we're going to cover: why are we going to offer health insurance to our employees and or their families, and what types of plans are best, and the cost and tax benefits. What is the ACA, the Affordable Care Act, and what are the requirements and fines for non-compliance? How would you get started offering benefit packages, and who pays for the different benefits offered? And then I'm going to go into Medicare a little bit. And a lot of people don't understand what it is or what you do when your employees need it. Who I am: my name is Ron Hyman. I'm the owner of insurance shops. I'm a licensed agent for all types of insurance. And my mission here is simple, and that's to provide innovative solutions for both individuals and commercial organizations. Simply put, we're brokers and insurance agents for all types of insurance, representing 200 companies. We're one of the leading expert health insurance brokers, and so this has already been said. We are recognized as an elite circle of champion agency with healthcare.gov since it started, and we're in multiple states. We won Best of Bucks recently. Our experts promise using insurance products to solve clients' insurance pains and leave them in a better place than when they first contact us for help. And we do this by saving clients money, increasing their coverage, or in most cases, both. I'm currently the president of the Feasterville Business Association. I'm currently president of a professional business network in Bucks County, a member of Lower Bucks County Chamber of Commerce, and I was the member benefits administrator last year for them, current board member of LaTip in Newtown, and a current member of BOSS with the Lower Bucks Chamber. Current member of Bucks County, Montgomery County Chamber of Commerce, and current member and sponsor of the Newtown Business Association, Southampton Business Association, Bucks County Business Directory. Married, father of three, and my kids are all doing well. I have a physician assistant, a lawyer, and a CPA. Throughout the years, Insurance Shops has cultivated invaluable relationships with nationally recognized insurance carriers, and these relationships have enabled us to earn high-level contracts and gain direct access to a wide variety of products. Our portfolio of products include Medicare Advantage, supplements, Part D, health, and I'm going to go into what all these are: health, individual, group, dental, hearing, vision, accident plans, critical illness, life, disabilities, and annuities. We work hard to ensure that we have complete understanding of all policy rates and offerings. Health insurance is a necessary protection against the high cost of medical expenses. Unfortunately, health insurance is not a one-size-fits-all for incurred expenses. For this reason, we work hard with a variety of different carriers so that we can provide the best coverage to both individuals and groups of all sizes. Some of what we insure are employer health insurance, individual family health insurance, Medicare supplements, auto insurance, home insurance, business insurance, dental, vision, life, long-term care and annuities, accident plans, critical illness plans, short-term health insurance, home health care, nursing home. Nursing home and home health care are options to long-term care, by the way, and they're much less expensive. We also do travel insurance. Most plans don't cover you when you travel outside the U.S., and most people don't even know they're not covered when they travel outside the U.S. We became experts with the Affordable Care Act. We offer self-funding employer plans, final expense plans, disability, pet insurance, and bonds. Some of the companies that we deal with, it's just too numerous to even put on all these pages. Simply put, health insurance is a protection against medical costs. A health insurance policy is a contract between an insurer and an individual or group in which the insurer agrees to provide specified health insurance quotes at an agreed upon price. So this is basic stuff. The cheapest health insurance usually provides either direct payment or reimbursement for expenses associated with illness and injuries. The cost range of protection provided when you buy health insurance will depend on the insurance and provider and the particular policy you purchase. If your employer does not offer you the cheapest health insurance, you may wish to purchase health insurance on your own. And we offer many different types of plans. So to get our expert advice on what is best for your needs, it's a simple phone call. So what is the Affordable Care Act? The Affordable Care Act came into being approximately 7 years ago with then President Obama. And what they said was that in order to be considered covered under the Affordable Care Act, everybody had to be, or you were going to be fined if you weren't covered. And in order to be considered covered, your plan had to offer the 10 minimal essential elements of health insurance in order to be considered on a valid plan. If your plan didn't have one of these 10 things, you weren't on a valid plan, and you can be fined for not having a health insurance plan. Health insurance, or any insurance, really works by the law of large numbers. If everybody pays in, then there's money there to pay for the people that are sick. But if everybody doesn't pay in and only the sick people pay into it, there's never going to be enough money to pay the bills for when people need it. So that is the premise of health insurance, and that's why they came up with this, saying, okay, and prior to the Affordable Care Act, a lot of these things were not included on plans. Plans can choose whether or not to include it on their plan, and a lot of them didn't. Preventative and wellness services, for instance, that's a free, that's free on every plan now. So if you don't have it on your plan, you're missing out, and you could be fined. The fines, however, did go away under President Trump recently, which causes a lot of people to not pay into the system, and is going to lead eventually, in my opinion, to not having enough money in the system again, and the system could run out of money to pay bills eventually. So it's health insurance, or any insurance, only works if everybody pays in. Yeah, the ACA also requires that insurers provide coverage to anyone, regardless of pre-existing health conditions. So that was huge. One of the biggest reasons people went bankrupt in this country prior to the ACA was people that had health insurance and then had a medical condition, and you kept paying for it forever. You had copays, and your expenses would go on, and someone that had cancer maybe for a couple of years would end up paying deductibles and expenses, and would end up with hundreds of thousands of dollars in expenses. So one of the main things that the Affordable Care Act did was it added something called out-of-pocket maximums to every plan. And once you hit the out-of-pocket maximum, which is going to be all your expenses for the year for all these essential health benefits, your plan's going to cover 100% of those benefits after that. The out-of-pocket maximum this year is $8,700 for individuals and $17,400 for families. If you get, like I said, if you get a terrible disease, cancer, heart attack, whatever, stroke, COVID, and your expenses are hundreds of thousands of dollars, which is normal nowadays. Once you're out of pocket $8,700, these plans will now pay everything after that. And nobody's going to go bankrupt owing $8,700. You can actually negotiate that with the hospitals and providers and pay that out over a couple of years. And you'll have almost like a small car payment. But you're not going to end up bankrupt, and your whole life is not going to be ruined. Affordable Care Act. It's here. It's not going away. There's an open enrollment period every year to find low-cost health insurance coverage in which any individual may enroll through the marketplace. Now, there was a national marketplace called healthcare.gov, but the states originally were told you can also have your own marketplace in each state. Last year, Pennsylvania and New Jersey both decided to opt out of the federal marketplace and have their own marketplace for coverage. In Pennsylvania, it's called Penny. And in New Jersey, it's Get Covered New Jersey. We have embraced that, and we are now a licensed expert with both those plans. And they do encourage everybody signing up to use an agent. So if you click Get Help, there's going to be a list of agents that comes up, and there's going to be a list of expert agents, and we're listed under one of those. All year long, if you missed your open enrollment period, there are special enrollment periods where we can also enroll qualified individuals. And there are many qualified events. So you can contact us to see if you qualify to enroll. And we've done hundreds and thousands of clients already. Let's go back to the special enrollment periods. Open enrollment runs November 1st through December 7th every year, through December 15th every year. If you enroll during that time, your plan will start on January 1st. Because of COVID, there's been a lot of extensions to that. This year, it did get extended till the end of January, but we're out of open enrollment now. If you do still need health insurance, there must be some kind of a life change in order for you to enroll. A special enrollment period is, they'll let you enroll if you have such things as within the last 60 days, if you were married, divorced, widowed, separated, had a baby, adopted a baby, got out of jail, moved from another state, or lost your employer coverage. I'll get into the lost employer coverage in a little bit as to what you can do for your employees if that happens. Like I said, Penny is the new state exchange. There are a lot of impersonator websites. Don't get caught up in those, which is another reason to call an agent. I have people all the time who go to penny.gov, or which is not the official site, or they spell it wrong, and all of a sudden they're bombarded with hundreds of calls, and for years they're going to get bombarded with people trying to sell them health insurance or plans that are like health insurance that really don't cover you. There's even backwards plans out there. You see those signs on the telephone poles all the time. Mega Insurance, for instance, is famous for that. They sell backwards plans. So they'll tell you, yeah, if you go into a hospital, $100. If you see a doctor, $20. But when I say they write it backwards, it's because if you get sick and go to a doctor, they pay $20. If you get sick and go to a hospital, they'll pay $100. You're responsible for the rest. So if you have a $10,000 bill in the hospital, they're paying $100. You're responsible for the rest. And we get calls every year from people that bought those telephone pole insurance policies, and they're looking at $50,000, $60,000 bills, which there's nothing I can do about except get them enrolled in the correct plans from that point on. Pennsylvania residents now determine eligibility and enroll through Penny instead of healthcare.gov, like I said. and your information has been migrated over from healthcare.gov. We did that last year for all our clients. And for our long-term clients, we in most cases are still attached to the service and can help them out year-round. If you have an agent like us, then if something goes wrong during the year, we're there to assist you, and we do have the phone numbers and can contact many people that the average person doesn't have access to help them out, getting bills paid, people that lose their coverage. We can help with that. Penny.com is not meant for everyone. Now, what you pay through Penny is based on subsidies. If your income, and when I say income, we're talking about modified adjusted gross income based on your federal tax filing, is too low or too high to qualify for the APTC, the Advanced Premium Tax Credit, also known as a subsidy, you may be better off applying directly through an insurance carrier. One of the things that we can do usually within a few minutes is tell you, based on where you live and your age and your income, is how much of a subsidy you can qualify for. If your income is too low to qualify, you can explore such things as Medicaid, and we can help direct you to the right place. No matter what your situation, we don't charge any fees for our time. We get paid by the insurance carriers to help people out. That's something a lot of people don't know. Going through brokers or agents costs the same to use us as to do it yourself. So you don't do your taxes yourself. You don't do your brain surgery yourself. Why would you even attempt to do something like this yourself? Get help. It doesn't cost you any extra, and you have experts on your side when you need it. The process to enroll is simple. First, we determine if and how much of a federal subsidy you qualify for, and then help you shop for the best plans with the money you qualify for. In many cases, we qualify you and can upgrade to silver. We can upgrade your silver level plans with cost sharing reductions and get you reduced cost plans. And with the cost sharing reductions, your plans will then look like platinum level plans for silver level pricing, and we'll supply you with a what to do next frequently asked question sheet. And we're also certified to help children enroll in the CHIP program. CHIP is available to all kids in Pennsylvania, and it's a free program for all the children. People still think today that CHIP is only for the low income. It's not. You can be a multimillionaire and put your kids on CHIP. And it's a free program for all the kids. So one of the issues with CHIP, though, is that not all the providers accept it, and there are multiple carriers. So a lot of times being on the parents' plan through Penny will be a better solution for the kids. But again, if you're on a Penny plan through Blue Cross or one of the other carriers, you still have copays and deductibles, whereas through CHIP, everything is free. There are different levels of what you pay for CHIP also. CHIP may not be free totally if you're upper income, but you can still get it with no questions asked. Many of our clients try the Penny process for themselves, and either were not successful doing it or did not get the outcome they qualified for. And during the enrollment process, they had no one to help them and ended up making huge mistakes that could have been costly. We've reduced the enrollment process from many aggravating hours to a few minutes on a one-page sheet. We correct mistakes for people all day long who have done it themselves, and then we consult with the people, getting them the best plans that they qualify for and explain what they get. Our clients simply have to contact us to make the life changes, and we answer the phones. That's what we're known for, is service. Short-term plans is something else that everybody has access to all year long. So if you don't have one of the special enrollment periods and you need health insurance, or your employees need health insurance, you can always sign up for a short-term plan. Now, these are available in Pennsylvania. They are not available in New Jersey. Short-term plans are customizable, deductible plans that generally cost fractions of what the traditional plans cost. You can use these plans for 1 month or up to 12 months at a time. They offer limited benefits, so they don't have all the things that you see on the ACA. They don't have the job, your special enrollment period, or if you think your affordable care plan is not affordable, or if you don't qualify for subsidies for one reason or another, these make good options to the Affordable Care Act, and you can save thousands of dollars yearly by being on these plans. Even though they don't cover pre-existing conditions, they may not cover all the 10 essential elements, they are great options for people, and they will get you to the next open enrollment period where if something medically happens and you need an amazing plan, it will get you there. So again, they don't cover pre-existing conditions, but they will cover anything new that goes on. Okay, so as an agent, we represent the clients. The insurance companies are not our clients. Our clients are our clients, and we help people maximize their dollars to get the most for their money. So why offer health insurance to your employees? There's only 2 reasons, and there only has ever been 2 reasons, and that's for retention of your employees and recruitment of your employees. You know, why does your competitor offer health insurance? You know, if your competitor is offering health insurance, they're going to get the better employees because they're offering these benefits. So let's go into that a little bit. Group medical insurance is way more complicated today than it used to be. We have helped many employers get health insurance for their companies. You have to have a group of at least 2, and there are different levels of group coverage. 2 to 50 is one, 2 to 50 to 100 is the next level, and over 100 is the next level. Once you get to over 100 employees, you're mandated by the ACA to offer health insurance. As you can see, what I've been talking about, being under 50, for instance, employees, there's no reason to have a group plan. You can put all your employees on the individual marketplace, and the subsidies will offset the cost, but the government is paying for those costs through the subsidy. Well, the government doesn't want to be paying those costs. They want the employers paying the cost for health insurance for their employees. So once you get to the 100 mark, they mandate that you have health insurance. Once you get to the 50 mark, they start fining you for not offering health insurance to your employees. We will consult with employers to put plans in place. And I always tell my clients, don't wait until you get to that 50 employee mark before you put a plan in place. Do it early, because once you hit the 50 employee mark, health insurance companies will ding you for not having a plan in place. In other words, they will they will consider that, hey, one of the reasons you'd never put a plan in place is because you might be 50 cancer patients, and it was too costly to do it, so you went for the subsidies instead. Well, once you hit that 50 mark and now you're mandated to do it, they're going to price you as 50 cancer patients instead of 50 marathon runners, and your prices will get ridiculous. So I always tell my clients, hey, maybe when you hit the 30 mark of employees to start thinking about putting a plan in place. And we're not talking about 50 full-time employees. What the government goes by full-time equivalent employees, where basically every part-timer, it takes about 3 part-timers to equal 1 full-timer. So companies that have a lot of part-timers don't even realize they're at that 50 employee mark, because they're thinking, oh, I have to have 50 qualified employees to be qualified as a full-time employee under health insurance. You have to be working 30 hours a week at a minimum, and be considered full-time. And it's 30 hours a week is considered full-time for health insurance reasons. If you have a bunch of employees working 15 hours a week, they're going to add them up. And when they get, three people working 15 hours a week, you're 1.5 full-time employees there. So they're going to count the total hours worked. So to find out what's your best options, we have group census request forms, and then we'll run the numbers and tell you through the hundreds of plans available for groups what all your options are, and we'll help you narrow it down to the best options for your group. We'll run the quotes for all the insurance companies in your area and recommend plans that meet the needs of you to accomplish your goals. We're available at all times to answer questions, help people enroll, disenroll, change plans, help with the yearly renewal, help get bills paid, and help educate the employees. We put on educational seminars for the employees and the dependents on the different coverages that they have. When was the last time you had an educational seminar done in your place for your people? There's something called the Shop Exchange through healthcare.gov and with the ACA that has their own rules and regulations for the last couple. This was for the groups to enroll groups through the Affordable Care Act, but it became a disaster, and it still is. And we're not recommending anybody enroll groups through the Shop Exchange at this time, because it's going to be a lot less expensive to do it off exchange. There are out-of-the-box solutions to complex health insurance marketplace and Shop Exchange problems. One of the most popular out-of-the-box is our Bright Choices Exchange for groups, and through that there are numerous out-of-the-box which really get complicated on putting defined contribution plans, private exchanges, health savings accounts, and things like that through the Shop Exchange. I'll get into those in a little bit. There are different plans that you can offer your employees now also. Qualified transportation plans. So if your employees are taking SEPTA to and from work, they can pay for it with pre-tax dollars. Section 125 cafeteria plans, where you offer from a menu of plans to your employees. These are all tax deductible to the employer when you put plans like this in place. Daycare paid for with pre-tax dollars. Health reimbursement arrangements, those are getting more popular now, where you set aside a limited number of dollars for the employee to use for whatever way he wants to use it. Flexible spending accounts and employer compliance services. Flexible spending accounts are again dollars that you set aside ahead of time, and the employees have a use it or lose it type plan. And we help with putting these plans in place and helping you with our people that we have partnered with will help with the compliance services and the tax ramifications for groups. So what types of plans are best? Traditional health savings account plans, health reimbursement account plans, qualified. saving health reimbursement accounts, flexible spending. As you can see, there are a lot of choices and a lot of plans available for the employers nowadays. So, and get an expert to help you through all this and figure out what's going to be best for you and your employees and for your bottom line. I'll touch on health savings accounts. Actually, I'll touch on both of these. Traditionally, on a traditional plan, there's 3 parts to the plan. You have a deductible, a copay, and an out-of-pocket max. Well, the deductible is what you're responsible for before the plan pays anything. So a lot of times there's no deductible, $1,000 deductible. There's high deductibles that are $5,000 or $6,000. So that means the client or the patient is responsible for that money before the plan, the health insurance plan, pays anything. Obviously, the higher the deductible, the lower the cost of the plan. Then comes the copay, and the copay could be either a set dollar where you might pay $20 for a doctor after deductible, or sometimes it doesn't apply. The deductible doesn't apply to the copay, or it could be a percentage where after deductible you'll pay 20% and the plan will pay 80% until you reach the out-of-pocket maximum. I touched on that before. This year it's $8,700 for most individuals and double that for families. Once you hit the out-of-pocket max, the plan pays for everything. So that's a traditional plan. There are self-funding plans that you can offer your employees. Basically, you're going to self-fund for the little things, the doctor visits and the tests, but you purchase a catastrophic coverage plan so that when your medical costs hit a certain level, and that level could be $50,000, let's say, when your out-of-pocket costs hit $50,000 for your group, the catastrophic plan will kick in and then pay everything after that. So those are usually cheaper ways of doing it because you're self-insuring up till the $50,000 mark, and after that, everything will be covered, and all you're purchasing is a catastrophic plan. The benefits of that are that if everybody's healthy, or you have healthy people, that year, the unused funds can be returned or used to lower costs in the next year. So that has been a very popular thing in the last few years for keeping employer costs lower. Health savings accounts are very popular. A health savings account is it lets you set aside money on a pre-tax basis to pay for qualified medical expenses by using untaxed dollars in a health savings account to pay for your deductibles, copays, co-insurance, and many other expenses. You can lower your overall healthcare costs. People that have, I guess, make some decent money and are looking for tax shelters, health savings accounts are a wonderful opportunity for them. I like to tell people to think of a health savings account like an IRA. Everyone knows what an IRA is, where you put pre-tax dollars into an account. An HSA is the same thing. You put pre-tax dollars into an account. For this year, it is, what do I have here for 2021? Oh, that's deductible. It's on the next screen. I believe it's $3,600 you can put in yearly pre-tax dollars and deduct it off your taxes. But you can use the funds in an HSA at any time to pay for any of your qualified medical expenses. And you can contribute to an HSA only if you have a high deductible health plan. So in order to have a high deductible health plan, the plan, including a marketplace plan, the only thing that's going to be covered before that deductible is your preventative care. For plan year 2021, the minimum deductible was $1,400 for an individual and $2,800 for a family. For 2022, it's the same. But for most high deductible health plans, you're going to see deductibles of $5,000 or more. For 2022, if you have here it is, if you have a high deductible health plan, you can contribute up to $3,650 for self-only coverage and up to $7,300 for a family into an HSA. HSA funds roll over year after year, so that's your money. You don't, and if you don't spend it, somebody that's younger and contributes $3,600 for themselves yearly into an HSA and has a lot of healthy years, by the time they're 65, they're going to have a boatload of money that they can then take out and use for whatever reason they want. Because once you hit 65, that money can be used for anything that you want. You simply are taxed at the then rate. Or you can continue to use the money in that account tax-free for all your medical expenses, even in the Medicare years. Health savings, so they roll over year after year. You can earn interest on them and you can use it as an investment vehicle. So the money in there grows tax deferred also. Some health insurance companies offer health savings account for their high deductible health plans. Check with your company. I can let you know that also, if you have a health savings account plan available to you. Things to think about when choosing a health savings account. Some health savings accounts have fees associated with them. Like it's usually done through a bank, and I tell my clients you can do it through your bank or one of these online banks that charges less fees, but it might cost you $20 a month or so to manage the account. And the fees are for services, because you get a debit card. You can do online banking. And when you go to a doctor, hospital, or test, you just simply show your debit card and the money comes out of the account to pay your bills. It's then reported to the insurance company and it comes off your deductible. And then when you reach your deductible, the insurance company from that point on will pay all the expenses. Flexible spending accounts are similar to a health savings account, but these are flexible spending arrangements that the employer sets up. The employer sets up an account and puts money into it and funds it at the beginning of the year, and it becomes a use it or lose it type account that the employers can use to pay for some of their out-of-pocket healthcare costs. You don't pay taxes on this money, so you'll save an equal amount of money on the taxes that you would have paid on that money. Employers make contributions to your to your flexible spending accounts. They're not required to, though, but it's a way for employers to keep costs lower because these plans cost less than a traditional plan, both the health savings account and the flexible spending accounts. So to the employer, it could cost them less, and they look like heroes by giving money to the employee. At the end of the year, if the employee doesn't use the money, the employer can take it back or use that money for next year. Flexible spending accounts are limited to $2,800 per year per employer. If you're married, your spouse can also put $2,800 into the account. You can use funds in your flexible spending accounts to pay for certain medical and dental for you or your spouse if you're married and your dependents. You can spend flexible spending account funds to pay for deductibles and co-payments, but not for insurance premiums. That's key. People think that they can pay for insurance premiums. You can't. You can spend flexible spending account funds on prescription medications as well as over-the-counter medications. But you must have as long as you have a doctor's prescription, everything would be covered. Reimbursements for insulin are allowed without a prescription. Flexible spending accounts may also be used to cover costs of medical equipment like crutches, supplies, bandages, diagnostic devices like blood sugar test kits. There are limits and grace periods and carryovers. You generally must use the money within the plan year, but your employer may offer one of two options. Forgive my dogs, the mailman's here. They love mailman. It can provide a grace period of up to 2.5 extra months to use the money in your flexible spending account. It can allow you to carry over up to $570 per year to use in the following year, and the employer can offer one of these options, but not both. It's not required to offer either one at the end of the year or grace period. You lose any money left over. So like I said, it's a use it or lose it type thing. There are qualified small employer health reimbursement arrangements are very popular now also. So small employers who don't offer group coverage to their employees can help employees pay for their medical expenses through one of these programs. If the employer offers you through one of these programs, you can use it to help pay your household's health care costs, like your monthly premium for qualifying health coverage. There are certain small employers, if you have less than 50 employees and you don't offer a group plan, you can contribute to the employee's healthcare costs through a QSE HRA. It allows the employers to provide non-tax reimbursement of certain healthcare expenses like health insurance, premiums, co-insurance to employees who maintain the minimal essential coverage. So your employee can go get a marketplace plan or a plan directly from Blue Cross or one of the other carriers or through Penny, but they can't get a subsidy. It can't be a subsidized plan. And now the employer can offer one of these health plans to reimburse the employee. So it's a benefit to the employee and it's a tax write-off to the employer. Is your small business eligible to offer this? To qualify, a small employer generally must have fewer than 50 full-time employees. They must provide the arrangement on the same terms to a full-time employee. Reimbursement amounts may only be based on age and the number of individuals covered. And you can't offer a group health plan like shop coverage or a flexible spending account. So this is only for people or employers that don't offer a group plan, but this is a way that you can offer benefits to your employees and get a nice tax credit. Small employers can decide on what they'll contribute to their employees' healthcare costs up to an annual maximum that's set by the IRS. Employees pay their provider or insurance company for their healthcare costs, then submit proof of payment to being reimbursed. Reimbursement is tax-free. If an employee doesn't submit a claim, the employer keeps the money, though they may choose to roll it over from year to year while the employee is still employed by the business. Typically, the QSE HRA amounts claimed by the employees are paid monthly by the employer. For 2022, the maximum amount of payments and reimbursements is $5,450 for self-only coverage and $11,050 for family. Generally, the amount you provide your employees will affect the amount of premium tax credit your employees are eligible for with the marketplace coverage. I hit on that. They can't get the tax credit if you're offering this plan. So if you have higher wage employees, this is a great option. For the lower wage employees that do get tax credits, it's probably not going to benefit them, and you may lose your employees by offering this. How do you set up one of these things? Small employers, you can set this up at any time. And actually, you can set up any group health plan at any time. There are no open enrollment times to set up group plans. You need to give written notice to your new employees as soon as they're eligible to participate, and 90 days before the beginning of each plan year for your current employees. And there's an IRS notice to do. You may want to consider how your employees can get qualified health coverage when picking a start date. For example, if you're starting on January 1st, it allows the employees to choose coverage during the individual open enrollment period. And in most cases, plan deductibles reset on January 1st each year. If you're newly providing this plan to your employees, employees may qualify for a special enrollment period. So if someone did sign up during open enrollment and now you're going to offer this in July, they can now get this plan. Newly hired employees may also qualify for the special enrollment period if it's outside of open enrollment. So this chart really shows the difference between an HSA, an FSA, and a QSE HRA. So as I showed you, what is it? We've touched on that. How is the plan available? These are all available through the employer, the eligibility requirements, and this chart goes on for pages. If anyone here is interested, I will be glad to send them this information and email it to you. Can self-employed individuals set up the plan? Only on the HSA. The FSA and the QSE HRA are set up by the employer. Who contributes to the plan? On the HSA, the individual does, or the employer. On the FSA, it's the employer and the employee, and the QSE HRA is only the employer. Funds are contributed pretty much on the HSA by depositing money into an account. That account belongs to the employee. On the FSA, the employee signs a salary reduction agreement and the employee directs the money from his paycheck into the FSA account. And on the QSE HRA, the employer makes a benefit allowance available. Who owns the money? Well, on the HSA, that money belongs to the individual. On the other two, it belongs to the employer. In all three, the IRS will determine what money or what the tax benefits are. Can the funds be used to pay for other non-qualified expenses? Only on the HSA. Can they be used for anything else? It can be used for non-qualified medical expenses, but they'll be subject to tax if you do it. Can the funds be used to pay for health insurance premiums? Only on the QSE HRA can that happen. However, on an HSA, when you become later in life, if you have a lot of money left in your HSA account, I'll note you can use it for long-term care insurance premiums. So that's a huge benefit. Can family members be covered? Yes, on all three. And what's the tax treatment of the participant contributions? I already hit on that. So tax-wise, the benefits are tax-free to the participant or your employee. On the FSA, it's tax-free. And on the QSE HRA, the reimbursement of the qualified costs are paid to the participant. This is pretty exciting stuff, guys, isn't it? Can on the last thing here, can the funds be rolled over? Yes, no, and yes. Can the participant keep the plan funds if the employment is terminated? Yes, on the HSA, because it belongs The funds belong to the employee, no on the other two. And when are plan funds available? As soon as the account is opened on this, and as soon as the amount is presented for reimbursement on this. So the employee has to get involved on the QSE HRA and submit bills to get his money. Only on the HSA will the money grow by earning interest. And on the last line is the maximum that you can contribute and take a tax deduction for. On the HSA, I haven't noted, if you're 55 years or older, you can contribute another $1,000 per year called a catch-up contribution. And can the participant also have coverage with another plan? Generally, no. On the FSA, yes. And the QSE HRA, yes. How much of the plan funds are available to a participant at any time? An amount equal to what was contributed. So this is getting pretty involved, and I think I'm going to skip through this time-wise. I'll touch on COBRA since I mentioned COBRA. By the way, is when your employee leaves, you are, if you're less than 25 employees, you can tell them they can stay on your plan for another 9 months, called mini COBRA, and you can self-administer a plan. So if your employee leaves today, they can stay on the plan pretty much through the end of the year. You don't have to pay for it anymore. You just tell them that they can stay on your plan, but they have to bring you the premium money, and they can stay on it as long as they're paying for it. It becomes very costly to them at that point, where usually I'll instruct my clients to tell the employee to give me a call, and I'll get them on the marketplace at that time. This is interesting. These are the things that you can use your money in your HSA, FSA, and QSE HRA for. As you can see, it's a lot more than just the medical expenses that a traditional plan covers. So you can use the money in an HSA for long-term care or over-the-counter, some over-the-counter things. I'll leave that up there. Even weight loss, which is interesting because that's generally not covered on any plan. Stop smoking programs. By the way, under traditional plans can rate up clients if they smoke, and it's usually a 20 to 25% rate up to your employees if they smoke. So you want to, and the employer doesn't have to pay for that, by the way. They can pay the base rate and charge the employee the smoking premium, whatever that upcharge is, because that was their choice. The fastest way to get somebody from a smoking premium to a non-smoking premium is to enroll them on a smoking cessation program once they're on a plan, and they can usually graduate that in 6 to 9 months. And at that point, once they graduate, their premium is reduced to non-smoker. Things that don't qualify for that you can pay for out of the HSA or FSA or QSE HRA. Again, no weight loss programs are on both lists. So why would you want to offer an Affordable Care Act plan? Well, because if you don't, there's penalties involved. And the Affordable Care Act the penalties are increasing again for this year. For 2022, the penalty amount is $229.17 a month, or $27.50 annually per employee that goes and gets a marketplace plan with a subsidy when the employer should be covering them. So, like I said, if you're over 50 employees and your employees are going on the marketplace and getting subsidies, you're going to be hit with this fine. And that's for every employee, by the way. If the employer doesn't offer minimal essential coverage to at least 95% of the full-time employees and their dependents for any month during the tax year, you're penalized. And if at least one full-time employee receives the tax credit for purchasing coverage, you're going to be hit with that fine. Here's an example of how they calculate the penalty. If an organization in 2022, if you have 300 full-time employees and one employee receives the tax credit for 12 months, they're going to penalize you for all 300. So that would be your penalty. So it behooves you. This is why you have to have a group plan when you get over 50, because something like that can certainly hurt your company tremendously if your employee is going out and getting that tax penalty, that tax credit, I mean. It's eye-opening, isn't it? The penalty or employer shared responsibility for failure to offer coverage that meets the affordability minimum. So if you went out and you offered your employees one of these plans off the telephone pole, like I mentioned, you're going to pay $343,000 a month, or $4,120 per employee. And this is the penalty amount if an employee is assessed if the penalty does not apply. The penalty is assessed on a monthly basis for every full-time employee that did not receive an offer of coverage. So you must make sure and document. If you have a group plan, make sure that you have waivers for the people that don't want to join. So when the IRS comes knocking on your door and says, hey, Jane Doe said that you didn't offer her coverage, you can pull out a waiver and say, yes, I did, and they waived their right to it. Here's their waiver form. An employer with 10 full-time employees who receive a premium tax credit for 6 months would see an IRS penalty of $20,000. It's important to note that an employer can only receive the penalty or penalty A or penalty B, but not both. So aren't they nice? Employers that don't file the correct ACA information returns by the mandated deadlines will pay a penalty. $280 per return is that. So make sure your tax accountant knows what he's doing as far as the ACA. Here's another wonderful fine. If they're not filed by the deadline, they can assess a failure to file penalty per individual. If it's not filed accurately and timely, an employer that doesn't file a return with 300 full-time employees would see an $84,000 penalty. And the penalty amount increases if an employer intentionally disregards the filing. And I've come across many employers who are just playing with fire and saying, I can't afford to offer the health insurance. And up till now, the IRS hasn't been auditing for these things, but in the last year, they're starting to. So since the ACA started, this really hasn't been audited, but the IRS can go back 10 years. Failure to furnish. I don't know if I want to keep going into all these penalties. I'm scaring you off. Let's go into Medicare. Okay, change the subject a little. What is Medicare? Well, when you turn 65 or are disabled, there are everyone's mandated to have Medicare because everybody's paying for it your whole working life. And when you hit 65 years old, you get Part A hospital, which is free. If you've worked 40 quarters in your life. If you haven't worked 40 quarters in your life, you're going to pay $4.99 a month for your Part A, and it covers the hospital. Part B, again, you get this from the government, and this is what you pay. And it's income based. If you're making less than 91,000, you're going to pay 170, and these are the rates. So it is income based. Part B covers your outpatient costs, your doctors, and your testing. For 2022, these beneficiaries who are married and live with their spouse at any time with the year, but file separate returns. These are the costs for the Part B. Your out-of-pocket costs. So on Part A, again, it covers the hospital, but here's what it covers. If you're in the hospital days 1 through 60, you're going to pay $1,556. After 60 days, you pay the $1,556 and $389 a day. And after 90 days, and by the way, they count lifetime days, you're going to pay $1,556 and then $778. And after 151 days, there's no coverage. So somebody that's sick and spends half a year in the hospital, they can use up all their Medicare benefits. Part B, you have a deductible of $233 a calendar year, and then after that, Medicare pays 80%, and you're paying 20%. If you leave your state and go into another state, other states can charge another 15%. Some other things I'll note, you're responsible for your first 3 pints of blood. Medicare will pay after that. Skilled nursing facilities, so if you need rehab, you pay nothing. If approved for the first 20 days, after 20 days, it's $194.50 a day. On the Part B, there's a couple of other minor things. Mental health, you're responsible for 40%. And if your doctor doesn't take Medicare, you're responsible for the difference. Part A, nothing else is covered. Part B, foreign travel emergencies only. Guess what? They're not covered. If you leave the country, a lot of people don't know this, you're not covered. So I'm a big believer, if you plan on leaving the country, get some travel insurance. It's very reasonable. Part B, medical covers a lot of screenings. Most people don't even know all the things that they're entitled to. Let's move on. What's not covered by Part A and B, Medicare doesn't cover everything. If you need certain services Medicare doesn't cover, you have to pay for them yourself unless you have other insurance. Even if Medicare covers a service or item, you generally have to pay a deductible or copay. Medicare does not cover long-term care, folks. People think that it does, but it doesn't. That's what long-term care insurance is for. And it's very expensive if you don't have it. Medicare is a federal health insurance program for people 65 or over, or if you were deemed disabled prior to 65. And there are 3 parts. You can get Part A, Part B, and then you can get a Medigap plan, which is sold separately by private companies. And the Part D prescription plan is separately by different companies. This makes up one option. So you would have your Medicare Part A, which would cover everything I mentioned. Part B would cover everything I mentioned. And the Medigap plan, also referred to as a Medicare supplement, would fill in all the gaps that you saw on the previous screens. And you do need a separate Part D prescription plan. Option B would be to get Part A, B, and then you can pick up a Medicare Advantage plan instead. So in this instance, your Part C, your Advantage plan, is taking the place of your Part A and B. So a lot of people don't want the government involved in their business and will say, you know what, I'm just going to buy private insurance or Medicare Advantage plan. This year, there's a lot of free plans for Part C Medicare Advantage. When you're on an Advantage plan, though, some people refer to it as a disadvantage plan. It's more like a traditional plan. You're going to have co-pays and deductibles. And if you get sick, you could be responsible for anywhere between $5,000 and $6,000 in expenses. But you would have to be pretty sick to see that. Collecting Social Security at age 64 and 9 months. This is when you can enroll in Part A and B. So 3 months prior to your birth month is when you can start talking about Medicare. We probably see approximately 1,000 Medicare clients and help them a year here. And get an expert. It's very confusing. And we will sit down with you and go over all your options and figure out what's best for you. When you turn 64 and 9 months, you're usually enrolled automatically in A and B. If you're not, you should apply yourself 3 months before age 65. There are reasons why that's a yes or no. Enrollment periods for Part B, well, you can enroll at the 7-month period between age 64 and 9 months and 3 months after you're 65. Generally, you can enroll January 1st through March 31st each year, but you're going to pay a penalty. And you can enroll anytime while covered by your employer plan. So this is huge. When you have a group plan and you have employees over 65 on your group plan, well, group plans are usually, the prices you're paying are based on age. So if you have people over 65 on your group plan, I tend to go in there and tell them, hey, you can pull off those seniors off your group plan. I can put them on individual plans, a lot less expensive for you. The coverage is going to be a lot more, a lot better for them. You know, like if I put them on the A, B, D, and a Medigap plan, they're going to have no co-pays or deductibles for anything. No, and it's not an HMO. They can go anywhere they want. No referrals. And generally, it's going to cost them all in maybe $300. Whereas being on a group plan, it's costing the employer $700, $800, $900 a month. So it's a win-win. But I go into groups all the time and I see lots of seniors on their group plan because they don't know that the employee can come off and go on to Medicare at any time. Like I said, it's very confusing. There's the many different types of, or many different parts to Medicare. There's Plan A, B. These are the Medigap plans. So when you go on a Medigap plan or a Medicare supplement, there are these 6 different plans that are being offered now. Plan A, B, F, G. There's actually more than that. There's a C, there's a K, there's a high deductible F. You really have to find or dig into what is going to be right for the client based on their medical needs as to which plan is going to be best for them. The most popular plans are the G plan and the N plan. And again, these are the Medigap or Medicare supplements. These do not cover prescriptions. You still have to buy a Plan D prescription plan. Like I said, Medigap plan is also known as a Medicare supplement. It's private insurance that pays for the gaps that Medicare Part A and B do not cover. It's not an Advantage plan, which is typically an HMO. They cover 100% of the uncovered gaps for medical procedures and hospital costs that Medicare approves. As a rule of thumb, if the expense is covered by Medicare, it's going to be covered by the Medigap plan. If it's not a Medicare covered item, it's not going to be covered by the Medigap or Medicare supplement. In order to get a Medigap plan, you must have A and B first. Like I said, there's many to choose from. And many companies offer exactly the same plan. Buying an F plan from one company is exactly the same as buying an F plan from another, or a G plan from Aetna is the same as a G plan from Blue Cross, or the same as a G plan from AARP. And we sell them all here, and generally we're going to put our clients on we're going to pick the right plan, but then the cheapest company that offers that plan. Even though companies are selling the exact same plans, they can charge different prices. So buying an F plan from, let's say, Blue Cross could end up being a lot more than an F plan from Aetna. So you must shop around. And I tell my clients they must shop around. Pre-existing conditions will not have an effect on pricing or eligibility when you buy a Medigap plan. If you're new to Medicare and you sign up within 6 months of enrolling on a Medicare Part B, or if you were involuntarily terminated from another Medicare plan, or if you're coming off a government plan or group plan. Remember, I mentioned if you're coming off a group plan, you can get on a Medicare AB and do all this, and it's going to be less money than somebody staying on your group plan.
Rob,
Yes.
we're coming near the end here, and we'd like to leave about 10 minutes for questions. So are you pretty much wrapped up?
I am coming to the end, yeah.
Good. Okay, because we have some questions and I want to get them answered. So
Okay.
go ahead.
Some things to remember with a Medigap plan, there's no restrictions as to what doctors or hospitals you choose. There's no networks. There's never any co-pays with a Medigap plan, except for the end plan where you'll see a $20 copay. The skilled nursing is going to be covered, so you can have your skilled nursing. They coordinate the care. So again, if it's covered by Medicare, the Medigap plan will pay. The client doesn't see the bill. The most popular plans, as you can see here, are the F plan. Well, the F plan is not being offered anymore, so it's the G plan is 60%. Is what 60% of the people take nowadays. Shop around. Medigap plan for a 65-year-old woman can cost $869 or $52.95, depending on where you buy it. Don't forget, it's the same thing. So why would anyone want to pay $52.95 when they can pay $869? I tell people it's like buying a bottle of Pepsi. You can go to the 7-Eleven and pay $4.99 for the bottle of Pepsi, or you go to the Giant and pay 99 cents. It's the same bottle of Pepsi. It's the same theory with Medigap here.
Okay.
We can go into the drug plans. Drug plans are separate. There's a lot of information about these. I'll blow through it. What we do here, though, is we go through the best way to pick a drug plan is to crunch the numbers on the drugs that somebody takes, because each plan has different formularies, and based on the drugs that you take, no two people will be the same if they're not taking the same drugs. So if you crunch the numbers on the drugs, it will tell you which is going to be the best drug plan to take. That's something we offer for free for our clients, and we probably crunch the numbers on over 1,000 drug plan lists every year for our clients. The drug plans change every year, by the way. So just because you're on the cheapest and best drug plan for 2021, it could be the worst plan for 2022 for you. So seniors should shop every year.
Okay.
And that's pretty much it, I think. So this is what we offer, and that's it.
All right, couple of quick questions here. What's the child age limit for CHIP?
As soon as you turn 19, you're not eligible, so up to 19.
Okay. Can you outsource to an insurance company like Fidelity Life Insurance to do your health insurance plan? I don't think so, but.
I don't know who they are.
Oh, okay, fair enough.
I've never heard of Fidelity. Is Fidelity Life Insurance, you said?
Yeah. Mm-hmm. Yeah, no. It's okay.
Again, I don't know who they are, so they're probably just brokers doing similar to me.
Okay, so can you use an HSA to pay for COBRA premiums?
Can you use an HSA? No, you cannot use an HSA to pay premiums.
Okay, now here's something. I've got a small business and 3 or 4 employees. I really have no time to administer all of this, and yet I want to offer health insurance because it's going to be for me and the other employees. Do you offer some sort of a administration group within your insurance shop that can help?
One of the things, yeah, absolutely. One of the things that we will do, other than paying the bill for you, you just simply have to tell me I have a new employee and I want him added, or send me an email to remove an employee when they leave. If the employees have any questions on the plan itself, or their families, or any administration, as far as that goes, we do it here, and we take it away from the employer. So I just get an email that, hey, we have a new employee, I need him added for next month, or I can go backwards or forwards 30 days to add somebody or subtract somebody.
Okay, so you could act if they pay you, or if there's some sort of an arrangement with you.
We don't charge for it. Yeah, there's no charge.
Okay, you could be their almost HR person for this particular type of insurance.
Correct.
Good. Okay, because I think a lot of small businesses need somebody like you that they can call. Now, here's one that's interesting. If you're a small business with 2 full-time employees, married, and 1 will be the owner, okay, and interested in a PPO plan, is it better to look at individual plans or a group plan? And that's being the size here, it looks like.
Good question. So if you're saying the husband and wife are the owner, or one of them's the owner of the company?
One of them's the owner.
If you can deduct it, it depends on how you want the deduction done. Do you want to take the personal tax deduction, or have the company take the deduction and expense it? Usually, if the husband-wife qualify for subsidies, I will recommend going on to the marketplace and getting the subsidy rather than putting a group plan in place. Usually, putting a group plan in place, again, it goes back to what are the 2 reasons, if you remember, which is recruitment of employees and retention of employees. If you don't have those 2 reasons,
Right.
Put a plan in place. That was one of the first slides I had here.
Right. Understood.
Wow.
So here's another question that's kind of interesting. Do you provide any assistance with managing a QSEHRA, I guess, plan?
Yes.
You do?
Yes.
Okay. And is that, does it cost me anything, or is it free, assuming I take all the insurance from you?
No, that's not free. If you remember, the employee goes and gets his own plan, and you as an employer basically setting up this QSEHRA and offering money to the employee as a benefit so that he can pay for his premiums or co-pays and deductibles.
Can you compare the QSEHRA to the ICHRA? Are they comparable?
Yes, they are comparable, and you saw how complicated that.
Yes.
Yeah, you can. There are subtle differences, And I don't do a lot of the latter. I don't do a lot of either, actually, but I tend to lately been doing a lot of the self-funding plans have been the ones that are the cheapest. Because don't forget, to do the QSEHRA, your employee can't be qualified for any subsidies, and frankly, the subsidies right now are so high. For instance, I had a husband-wife the other day making $230,000 a year, and they were still getting $500 a month in tax subsidies, being on the individual plans.
Okay.
So they would lose that if you were doing either one of these.
Now, here's an interesting question. I'm not sure how you'd answer this. Is Ron, meaning you, only a broker for pennies or the marketplace?
No. As a broker, I help my clients find the right plan for them. The marketplace and penny is basically the place where you get the subsidy. So by going to Penny, they're going to tell you how much money you qualify for, and then you use that money to enroll in a medical plan. And so let's say you qualify for $500 a month, I can take that money and enroll you on either Blue Cross or Aetna, United, Ambetter, Cigna now is in this area, and that just lowers your cost from one of those companies. So I'm a broker for the insurance company.
Okay. That's very, very helpful to know that. All right. Well, we are right at our time. So first, I want to thank you very, very much. An extremely informative presentation. And we'll have you back again next year. And because based upon what you said, an awful lot changes every year.
Correct.
So again, thank you. I'm going to turn it back to our chapter chair, Linda Zengrilli, to some ending remarks. Linda?
Okay, thank you so much, Ron. Such an enormous amount of information to digest, but just as a reminder to all the people attending, you will get a copy of the recording. So if you missed anything, you'll be able to rehear it. We have also put Ron's information in the chat. And if you need help with any of your business needs, please go to our website at buckscounty.score.org and request a mentor. And Ron, of course, will be in our resource guide that we as mentors refer our clients to. So there are many ways we can help you, and I hope you'll take advantage of it. And once again, Ron, thank you so much. We really appreciate all this information, and I'm asking everyone to join us once again next week, where we're going to have a presentation on the mindset of a successful business owner. So it's a good chance to say to yourself, do I have what it takes to be a small business owner? It's a very interesting presentation. We've done it. I think last year we did it as well. The speaker is very, very good. So I'd encourage you all to sign up for that. But for today, thank you once again for attending. And I hope to see you at a future event.
Take care. Thank you, Linda, and thank everyone. We're now signing off.